Have you ever wondered why certain blood disorders are more prevalent in certain parts of the world? Today, we dive into the world of thalassemia, a blood disorder that affects hemoglobin production, leading to anemia. The name thalassemia is derived from the Greek thalassa, meaning sea, as it was first identified in regions near the Mediterranean Sea. Fast forward to today, and thalassemia is a global health concern with significant prevalence in the Mediterranean, Middle East, South Asia, and Africa. Approximately 3% of the world population carries a thalassemia gene. Now, this isn't just a single disorder, it's a group of disorders with many types and varying degrees of severity. Each type affects individuals differently, ranging from mild to severe cases. The complexity of thalassemia makes it a fascinating, albeit challenging, topic to understand. So let's embark on this journey of knowledge together. Thalassemia, although common, is a complex disorder with many types and varying degrees of severity. Let's dive deeper in the upcoming scenes. Did you know that thalassemia is not just one, but a group of disorders? Indeed, thalassemia is a complex umbrella term, encompassing a range of blood disorders. The two primary types are alpha and beta thalassemia. Alpha thalassemia, as the name suggests, is caused by defects in the genes that control alpha globin production, a key component of hemoglobin. There are various forms of alpha thalassemia, including silent carrier, trait, hemoglobin H disease, and alpha thalassemia major, each with varying severity and symptoms. On the other hand, beta thalassemia is associated with defects in the genes that influence beta globin production. This type also has various forms, including thalassemia minor, thalassemia intermedia, and thalassemia major, or Cooley's anemia. While both types have distinct genetic causes, their commonality lies in their impact on the body's ability to produce healthy, functioning hemoglobin. Each type of thalassemia has its unique characteristics, but they all affect the production of hemoglobin in our bodies. So, what causes thalassemia? Well, thalassemia isn't a disease one catches like the flu or the common cold. It's a genetic disorder, meaning it's all about the genes you inherit from your parents. Now, let's get a bit technical. Our body produces hemoglobin, a protein in red blood cells that carries oxygen throughout our body. This is made possible by two genes, HbA1 and HbA2, or the HBB gene. But when there's a mutation or alteration in one or more of these genes, it disrupts the production of hemoglobin. This, in turn, causes the body to create fewer healthy red blood cells and less hemoglobin than it needs, leading to thalassemia. The inheritance pattern is also essential. If both parents are carriers of the faulty gene, there's a chance their child may have thalassemia. If only one parent carries the gene, the child may become a carrier but typically won't develop the disease. Thalassemia, therefore, is a genetic disorder that one inherits from their parents. How would you know if someone has thalassemia? Well, the signs and symptoms of this blood disorder can be quite varied, and they largely depend on the type of thalassemia a person has. One of the most common symptoms is fatigue. This isn't just your run-of-the-mill tiredness after a long day, but a kind of exhaustion that doesn't go away with rest. This is due to the fact that thalassemia affects the body's ability to produce hemoglobin, a protein in red blood cells that carries oxygen to all parts of the body. When your body doesn't get enough oxygen, it can make you feel persistently tired and weak. Weakness is another common symptom of thalassemia. This isn't just physical weakness, but also a feeling of being unwell or run down. It's a general sense of not being at your best, and it can interfere with daily activities. Next, let's talk about skin color. Thalassemia may cause the skin to become pale or even take on a yellowish hue. This is due to anemia, a condition in which your body doesn't have enough red blood cells or hemoglobin. And because hemoglobin gives blood its red color, a lack of it can lead to a pale complexion. Another sign of thalassemia can be facial bone deformities. This might sound alarming, but it's important to remember that these deformities usually occur in severe cases and develop gradually over time. They can result in changes to the bone structure of the face, such as an overgrowth of the maxillary bones, leading to a protruding jaw and cheekbones. Remember, the severity of these symptoms can vary greatly, from barely noticeable to severe. It's also important to note that these symptoms can be common to other health conditions too. Therefore, if you or someone you know is experiencing these symptoms, it's crucial to consult a healthcare professional for a proper diagnosis. Remember, early detection of thalassemia can significantly improve the quality of life for those affected. So stay informed, stay vigilant, and take care of your health. Who is at risk of developing thalassemia and what complications can arise from it? Let's dive into it. First, risk factors. Thalassemia is often a hereditary condition, meaning it's passed down through families. If both parents are carriers of the disease, the risk of their child developing thalassemia significantly increases. So, a family history of thalassemia is a key risk factor to keep an eye on. Certain ethnic backgrounds also have a higher prevalence of thalassemia. People of Mediterranean, Middle Eastern, South Asian, and African descent are more likely to be carriers of the disease. It's not to say that individuals from other ethnicities can't develop thalassemia, but these groups tend to have a higher risk due to genetic predispositions. Now, let's shift gears to complications. The severity of these can vary depending on the type of thalassemia one has. Foremost among these is iron overload. People with thalassemia can end up with too much iron in their bodies, either from the disease itself or from frequent blood transfusions, a common treatment for thalassemia. This excess iron can cause damage to vital organs like the heart and liver. Another complication is infection. People with thalassemia have an increased susceptibility to infections. This is in part due to splenectomy, a surgery often required for those with the condition, which can leave the body more vulnerable to infections. Finally, heart problems. Thalassemia major, the most severe form, can lead to heart diseases such as congestive heart failure and abnormal heart rhythms due to the stress of having to pump more blood than normal. But remember, not all is doom and gloom. Awareness of these risk factors and complications can lead to early diagnosis and better management of thalassemia. Knowledge is power, and in this case, it is a crucial component of staying ahead in the fight against this genetic disorder. So stay informed, keep learning, and let's continue to shed light on thalassemia together. Awareness of these risk factors and complications can lead to early diagnosis and better management of thalassemia. Is thalassemia curable? How can it be managed? These are common questions asked by many, and today we delve into the answers. As of now, thalassemia is a lifelong condition with no known cure. However, this doesn't mean that there aren't ways to manage the disease effectively and drastically improve the quality of life for those affected. The mainstay of thalassemia treatment involves three primary strategies: blood transfusions, ion chelation therapy, and in some cases, bone marrow transplant. Let's start with blood transfusions. These are crucial for individuals with severe thalassemia. Regular transfusions provide healthy red blood cells to replace the defective ones caused by the disease. While this doesn't cure thalassemia, it does help alleviate the symptoms and improve the patient's overall health. However, there's a significant downside to regular blood transfusions. They can lead to iron overload. So how do we manage this? That brings us to the second strategy, ion chelation therapy. This treatment involves taking medications that help remove excess iron from the body, thus preventing complications like organ damage. It's a balancing act, but with careful monitoring, it can be managed effectively. Lastly, in some cases, a bone marrow transplant may be considered. This procedure has the potential to cure thalassemia, but it's not without risks and is typically reserved for severe cases. The process involves replacing the patient's bone marrow, the part of the body responsible for producing red blood cells, with healthy marrow from a compatible donor. It's a complex process and requires a significant commitment from both the patient and the medical team. While these treatments can manage thalassemia, it's essential to remember that they are not one-size-fits-all solutions. Each patient's treatment plan should be personalized, taking into account their specific type of thalassemia, the severity of their symptoms, and their overall health. It's also crucial to remember that managing thalassemia isn't just about medical treatments. It also involves lifestyle changes, such as maintaining a healthy diet, regular exercise, and avoiding iron supplements unless recommended by a healthcare professional. Living with thalassemia can undoubtedly be challenging, but with the right management and treatment, individuals with this condition can lead active, fulfilling lives. It's about understanding the disease, working closely with healthcare providers, and taking an active role in managing the condition. Remember, living with thalassemia is challenging, but with appropriate management and treatment, one can lead a healthy life. Let's continue to work together to improve the lives of those affected by thalassemia. So, what have we learned about thalassemia today? We've journeyed together through understanding this blood disorder, starting with its types. We've examined thalassemia major and minor, each with its unique characteristics and impact. We delved into the causes, learning that it's a hereditary condition passed down from the parents to their offspring. We've recognized the signs and symptoms ranging from fatigue and weakness to more severe complications like organ damage. Our exploration of the risk factors highlighted the genetic component, with certain ethnic groups being at a higher risk. We've also scrutinized the complications, with the understanding that untreated thalassemia can lead to heart failure and other serious health issues. Lastly, we've discussed the management and treatment of thalassemia. This includes regular blood transfusions, iron chelation therapy, and in some cases, stem cell or bone marrow transplants. Remember, knowledge is power.